Happy Saturday. It's your girl, Ivie Okundaye Appiah. How are you guys doing? Perfect. Happy Saturday, everyone. We have a big show today, seriously. So while I'm going to let a few people kind of trickle in, and right away I'll drop the link for anyone who wants to comment or call. You guys, we're going to have some fun. All right, so let me know if you can see me or hear me well. I'm going to do my own check myself. Let's see. Okay, perfect. All right. Hi, good morning or afternoon, depending on where you are. It is me, Dr. Ivie Okundaye Appiah, and welcome back to my channel. In case you're new here, again, my name is Ivie Okundaye Appiah. I am an internist and also a nephrologist. And really, my goal on this platform is to encourage people to be their own health advocates. And I have particular focus on, it's really for everybody, but with particular emphasis on people who look like me, on Black communities as well. But really, this information is for everybody. So on your way in, make sure to like, share, and subscribe for sure. And then also definitely follow me on Instagram at Dr. Evioa, so DRIVIEOA. And, we're going to have a good time. Now, the other thing I want to mention is, we are trying to figure out, the best time period to go and do these lives. For example, do Saturdays work for you guys or a different time? So, just let me know how you're feeling, okay, about the time frame for these lives. But my goal is at least once a week to be able to share some content with you guys, all right? Hi, Ronald. Thank you for, joining us. Thank you. Says go Doc, go Ronald. All right. So so without further ado, let me tell you about the topic for today. We are continuing on with our Ultimate Health Plan series. And honestly, it has been really well received. And I'll talk about this in a little bit, but we really are giving out personalized health information and support for different roles that we play throughout life. So we talked about I'm forgetting, what was the first one? We've talked about a lot. The first one really was a professional woman. So that was a really good one. It was well received. People really were gravitating toward, and that's something I am and currently dealing with. Now, the other topics were relating to the divorcee and then also the bride. So if you haven't checked out those videos, absolutely go back and check out those streams. It was fire. It was fire. Okay. So without further ado, we're going to continue on our Ultimate Healthcare Plan series. And this time we are getting into the caregiver or support person. Okay. So let me see if I can share my screen here with you guys. Just bear with me for just a second. Okay. Ooh, this is going to be good. Okay, perfect. So you guys can see my screen. So now this session is about the caregiver and support partner. So again, part of the overall Ultimate Healthcare Plan series. So we've talked about the professional woman, the divorcee. The bride or groom is probably my number one of the top videos that I have on my channel. And you guys really, really like that one as well. Remember, understand your own personal history and family history and be able to communicate that with your spouse. So there are key things that you guys need to be able to do in your relationship or partnership, whatever, to be able to support each other. And part of that is knowing your own information and disclosing it. And then of course discussing it with your doctor to see how your partner can help out with that, okay? Oh, and by the way, you can probably see the background here. It was my birthday earlier this week. I'll spare you the details on how old I am, but I still have like my balloon, and I don't know if you guys can see that, and my flowers and gifts and stuff. So I decided to use that as a little bit of a background. But anyway, let's go ahead and dive in. So the reason I chose this topic was really based upon the feedback that you guys were really giving me. There are so many seasons of life, and we go through so many roles as people. If you're a woman, definitely roles of, womanhood that may or may not include being a wife, or may or may not include being a mom. So there's key roles that we all play. And this video is really about the roles of being a support person or a caregiver. Now, it really applies to everybody. It applies to everybody. So there doesn't necessarily need to be someone that's sick in your home, but this really applies for, a sibling who may be going to medical school and you want to be able to support him or her, or perhaps a spouse that's going to law school, or somebody who may or may not be ill, or someone in your life that has a responsibility that needs support. That is where you guys, the listeners, that's where you guys come in. So from a healthcare perspective as a physician, of course I see this all the time. I really want to be able to encourage patients and their families and their support system to implement, the best care plan. But unfortunately, sometimes as caregivers, there are extra responsibilities that will fall on the caregiver. So, for example, in the context of healthcare and medicine, usually there's a patient who may be sick and may be very sick, and that person's gonna need to rely on support people, family members, spouses, neighbors, friends, to support them through the medication, okay? And not really medication, or through their medical process. So part of that is that extra responsibilities take place for people who need for income, for childcare, for household activities. All of those things are going to be really relevant. So, for example, that patient who is now sick, that's potentially income that's lost in the home. That's one person who may not be able to provide childcare. So who's going to be able to do that? The household tasks of cleaning and, cooking, all of those things, that might have to shift to the caregiver or other support people. So that's additional sources of stress, number one. Number two, the other thing I want to point out is that there's really are sometimes limited support systems for the caregiver. And my goal in this live is just to say, do not forget about yourself. Do not forget about yourself. You also matter. You matter very much. And if the support person cracks, then we know as physicians and providers, then the healthcare plan for the patient is also going to be compromised. And I can give you an example. So for example, as you guys know, the leading cause of death in this country is heart disease. So we're talking about heart attacks and strokes together, right? So oftentimes I'm telling my patients, look, you need a low salt diet. That patient may or may not be doing the primary cooking in the home or getting the food. So I have to be able to communicate not just with the patient, but whoever does the cooking in the home, which may be a spouse or a family member. Okay, so what that means is if that primary person who's doing the cooking is not unfortunately going to be able to do the low salt diet, then my patient may be at higher risk for other things. And so that's part of my treatment plan for heart disease, for high blood pressure, oftentimes for those who have kidney disease. As you guys know, I'm also a kidney specialist. So this is huge. I'm just giving you a simple example so you guys can see, the larger picture. And honestly, a lot of you guys have even told me or reached out to me and said, I have a family member who does this or who has that. So you guys really are caregivers and can certainly understand this role. Okay, so next, my concern is that caregivers unfortunately sometimes neglect their own health and their own life because sometimes the burden is just shifted, their focus is shifted away from themselves into somebody else. So again, remember, you matter and that you need to also make sure that you take care of yourself, okay? Don't forget about yourself. All right, let's see what you guys are saying. Okay. RJ, oh my gosh, RJ, thank you for coming on the show. Thanks, RJ. It's my birthday. Um, Miss McKinday, I love you. Welcome to the channel, and thank you for the birthday wishes. Hey, Stout. Stout 411 is on top of it. And, again, you guys are coming from a diverse set of backgrounds and experiences. So definitely, if you're feeling what I'm saying, agree or have comments, type it in the chat. All right. Thanks, RJ. So I will go back to moving on to the next major point. So two kind of major things I want to talk about. Number one is depression and stress, and number two are coping mechanisms. So I'm just going to spend the next about 20 minutes and then we can wrap up, okay? So this is really important. Depressed mood among caregivers because of the extra burden on them can really impact their quality of life and impacts their own personal life, where oftentimes they're really missing their own, dare I say it, medical appointments. So sometimes what caregivers are doing is like, oh, if you have let's say a grandmother who has, cancer, and you're taking them to their cancer treatments, sometimes multiple times a week, they actually forget and say, you know what, let me just focus on this, and you put yourself in the back burner. No, I do want to say that a huge source of stress has been coordination of medical appointments, making sure appointments are actually scheduled, number one, and number two is also even taking them to appointments or taking your loved one to appointments. So that's a huge source of stress. And what do I mean by, depression? What makes a depression versus just feeling sad? It's when it starts to impact your quality of life, when it impacts what you ordinarily would do. For example, impacting your sleep, your appetite is a big one. I've literally seen this sometimes where stress and depression is so severe, people's memory is impacted. Like they literally don't remember what happened yesterday or the prior 6 months. It honestly can be devastating. It can actually be devastating. And while we definitely want to support whoever may be sick or who may need additional support, you as the caregiver and the support person also need that. So I want to give you some science and data behind why this actually takes place. So this is actually a graph that I took from an Annals of Internal Medicine research study. And what they actually did is they looked at about 1,000 patients who are palliative, meaning end of life care. So these are specifically palliative care patients, end of life, meaning unfortunately they're going to die in anticipated death in the next 6 months. They also looked at about 900 of their caregivers. So about 1,900 people, nearly half of which are patients who are very ill, and the other half are the caregivers that support them. And what they looked at is the incidence of depressive symptoms. So you can see in the white space, these are just the patients who actually had low level of care. So very sick, but low level of care. So the incidence of depression in this patient population was about 1 in 4, 25%. Now the gray box are the patients who had higher level of care. So unfortunately with that, the depressive symptoms was seen in about 31% of those patients. So, it's really challenging. So I say that to say that the depressive symptoms are actually associated with caregiver burden. So it appears from this that higher level of burden in the gray box is associated with, unfortunately, higher depressive symptoms, among caregivers. Now, when we look on the right half of, this graph, what we're looking at here is the interference of patient with personal needs. Okay, so how is this interfering with patient care, basically? And so what they found was that about 24% of the time, or 24% of these caregivers actually saw interference of patient with personal needs. And then as the burden increased, i.e. those with higher level of needs, that actually increased to 35%. So the main point here is that depressive symptoms are associated with higher caregiver burden and actually worsens with higher caregiver burden, and also impacts patient and their own needs. So there's actual science behind this. Remember, we're only looking at palliative patients here. Okay, so I just wanted to be able to share that with you because there's actual evidentiary support. Sometimes we think, we kind of know in our mind that must be the case, but when you also have data and research to support it, that's really important. That means if I really want someone to actually get better as a physician, if I want my patient to get better, for me personally, I have to consider and address the needs of the caregiver, because how else is that, is my patient going to get better, number one, but also recognizing that it can change the dynamics of the household. I hope what I'm saying makes sense. Okay, so I'll check in with what you guys are saying. So let's see. So Stella was saying, my sister and I were caregivers for my aunt. My sister was a primary and I was secondary. Okay, for about 7 years. Bless you. Bless you, Stout. She passed. Okay, I'm sorry to hear that. She passed in 2020 at 93 years of age. We experienced everything you were discussing. Oh. Thank you for sharing something so personal, Stout. I honestly, my hat's off to you, and honestly, all caregivers, because there are some things that you can't even say. It's just a feeling. I can only imagine. I can only imagine. So thank you for sharing your experience. Oh, thank you, Stout. Dr. Ivie, you're awesome for doing this platform. It's my pleasure. It's my pleasure. We're all in this together, right? Okay, so and by the way, I also like to include research studies because, first of all, the guys that, the people that actually watch my channel, you guys are smart. You guys are really brilliant. And you know what? You ask questions. So I can't just give you some superficial stuff. So that's why I try and take it next level. If it's too much, you let me know. But generally, you guys, you guys are very sophisticated. So I have to come to you correct. Okay. So, throughout my lives, I'm going to be incorporating some research and some science as well, and try and help, support the interpretation of that as well. So I'm going to just start in the middle section of this presentation by just doing a couple of case studies. So a lot of you guys know I'm into reality TV. I, am definitely have my, mind on pop culture. And of course, Real Housewives of Atlanta is a huge topic. Do you guys remember a couple of seasons ago where Nene and Greg were going through some challenges? And part of the challenge was Nene being a caregiver for Greg, who unfortunately had a medical issue. So, of course, I don't know them personally. I don't know details about their medical history. I'm just sharing what was already discussed on the show, on a larger platform. And I just remember being struck by, Nene. People really criticized her by saying, oh my gosh, you're being mean. You want to block your husband on social media while he's going through treatments. And I remember seeing her cry and just get so upset. And I could really identify with some of the things that she was going through. There's so much stress and emotional turmoil potentially for the caregiver. And sometimes it can be under-recognized. You, Nene, and you, whoever who needs to be a support system for someone, you need support. Okay, so it's a big deal. It's a huge deal. Okay, now Greg, thankfully Greg went through it, and it appears that he's moved past that situation. But Nene, I believe that she is in a better place, especially if her husband's in a better place. But that's just one example. Sometimes the marriage and emotional connection can be compromised because there's so much attention and focus on them. So I just wanted to share that with you guys and see if you had any comments on that. And I just cited my source for where I got that publication or that picture. Okay. The next person or couple I wanted to talk about and share is, Prince Harry and Meghan Markle. It's this one really touched me. Okay, why do I bring them up? Okay, first of all, this is the royal couple. There's a lot of controversy surrounding some of the racial climate in Britain. And of course, this is our Black princess and the challenges that she's having. I chose a picture of her when she's pregnant, because of everything that happened in England. Basically, the couple came out on an Oprah interview and said, "Hey, we're having some mental health challenges." Meghan openly talked about her depression, and that actually she unfortunately had suicidal ideation, which made me sick. Suicidal ideation meaning she had thoughts of actually harming herself, killing herself, and she's pregnant with child at that time. So it's scary. So it's not just that patient, but there are other people at risk. It's your family dynamics. It's the people around you. And of course, the spouse is going to be, involved. Anyone who's supportive or who cares, it's definitely, going to be directly or indirectly impacted. So I remember them talking about the impact on their family, on their connection as well on Oprah. And remember, this is like they're in one of the most iconic, wealthy families on the planet, and they were even talking about the economic consequences of being in the palace. You know, you know, of course, part of that was when they left the royal family, of course, but you just never know what someone's going through. So again, I just use these celebrities and these, stars as a jumping off point to talk about a larger discussion about how healthcare can really saturate and impact everybody in the home and that person's, social circle. Okay, so I'll end by sharing these last two slides about emotional wellness. So this is my JETS, the Guide to Emotional Wellness, or your JET to Emotional Wellness, using JETS. So kind of an acronym there. So I'm a fan of trying to support your emotional wellness by any and every means necessary. Literally, we have to protect our emotional health and wellness with everything we've got. And so these are some tools that can be helpful: journaling, exercising. You guys know I'm a huge proponent of therapy. Anyone who's been on this channel or who follows me on social media, you guys know I'm a big proponent of therapy, particularly, amongst people of our community and amongst Black people for so many reasons. And by the way, you don't necessarily need to have like suicidal ideation to get therapy. It doesn't need to be this big, dramatic, crying everyday scenario. I literally think if you have a pulse, you have a need for therapy, just because life happens and happens to everybody. So that's one thing I just want to mention. And remember that health and wellness is not just about, oh, I don't have COVID, right? Just like peace is not the absence of war. Just because, the United States is not at war with some country does not mean that relations with other countries are peaceful or that they're good, right? You can take that same idea in healthcare and wellness. Just because you don't have a disease, or just because, there's so much focus, of course, on COVID, Just because you just don't have COVID does not mean you're healthy. Just because you don't have heart disease does not mean you're healthy or that you feel good. Does what I'm saying make sense? I hope so. So what I'm trying to communicate here is that emotional wellness is something that should be pervasive for everybody. And these are practical tools to help you get centered. Like, what helps you get renewed? What helps you get rejuvenated? That part of that is having a spiritual practice. Part of that is maybe meditation. So I just use this as an acronym to just share with you briefly. Here are practical tips. Okay, the last thing I want to mention for the caregiver or the support person is really this, and discuss this with your physician and or your the patient's physician. Consider additional home services for patients. So let me give you an example. Let's say, Bobby is ill, okay, and has, let's just say, for example, COVID. Bobby's wife may want to, Bobby and the wife may want to consider having home services for the time that Bobby's sick, or just in general, okay? And what am I talking about? Sometimes when we're sick, we get deconditioned, meaning like weak. If you don't use it, you lose it. Even patients in the hospital, when they go in the hospital, we try and give them therapy, depending on the scenario. Because if you're laying in bed, in a patient bed all day, you can really get weak. It happens. Even in the intensive care unit, it absolutely happens. So sometimes we may offer physical therapy at home, or I've ordered, patient beds at home, or a home health aide to support the care for that person and also alleviate some of the burdens of other caregivers. And mind you, not everybody in the home can be strong enough or have the time or financial resources to be a caregiver. So I know that, like, for example, when I'm in the hospital and I want to discharge a patient, someone's in the hospital and I want to discharge them home, I'm nosy. Like, I'm really all in their business, trying to figure out, hey, so what is the scenario? Who's in your home? I get into the details. And a lot of physicians really will or should get into the details. Who lives at home with you? Do you, as a patient, do you need a cane or a walker or assistance? Who else is in the home with you? What do they do? I need a sense of who is available for you and what is that person's skill set. If, two elderly people are in the home and they're both elderly and they both need support, then it's going to be hard for them to be each other's support system. We may need to talk to family, adult children. I've seen all configurations because families are made up in different flavors and everyone has different unique needs and abilities. So I'm really get in people's business because it suits that patient. The next thing I want to say is, remember, unskilled services are also important. So it's not just about having a home nurse or a nursing assistant. Okay, what I'm talking about are people who can just do basic cleaning in the home or help with personal care, cooking, cleaning. Transportation is a big one, to alleviate some of the burden for the caregiver. So I just want to offer that. The next thing I'll point out is that there have been interventions such as those that I've mentioned that help to alleviate the burden on caregivers. And there's research and there's data behind this, including the Annals of Internal Medicine paper that I shared with you. And part of that is, the empathy of the physician as well, or being able to anticipate needs at home, not just in the hospital, not just in clinic, but how is this going to be implemented at home? My last piece of advice is for the supportive person is to include self-care activities, much of which are, I would say, these things: journaling, exercise, therapy, spiritual practice, and or meditation. But again, you guys have seen on my IG, if you follow me, self-care is not a luxury, it is a necessity, right? especially for the caregiver. We have to pamper ourselves. We have to put ourselves first. And that also means making sure you see your own doctor for your own issues. Okay? Because if you run out of gas, the whole operation may just be gone. So, you are important. And in order to help others, you have to help yourself. So that's really the, mostly what I wanted to share for today. So let me see what you guys are saying. All right, Stout. Okay. So there were times when my sister and I had to figuratively block my aunt when she was nasty, and mean to us. So I definitely understand what Nini was feeling. Thank you. Thank you. Yeah, because that person is going through their own emotional issues, and sometimes it's just the group dynamics. It's not easy. It's not easy. But again, thank you, Stout, for just being so transparent. Okay. Okay. So if you guys want to call in, definitely feel free to. If you want to share or ask questions, I will just I will say that. These are things that go on in my head. Again, with this platform, I'm just trying to, offer practical resources for people on this platform because you guys are smart, you guys are willing, but sometimes all of us, we can have challenges like, okay, how do I actually do this in real life? You know what I mean? I go back to the example of, the low salt diet for the patient who has high blood pressure or heart disease. It's a family effort, okay? Even in the past, I actually had interviewed a dialysis patient. I may release that interview soon, but I had had a conversation and production of a dialysis patient and her spouse, and what life was like for both of them and individually at the time of their diagnosis, and how they coped and how they supported each other. So, sometimes, how they say it takes a village to raise a child? It really also takes a village in moments of stress and strife, and healthcare is absolutely no different. So it's extremely important. The other thing I'll say is, don't underestimate your own abilities, your own powers, but also keep in mind that you're a human being too. Sometimes I'll share one thing with you guys. Okay, so for example, one time there have been a few times I've been in urgent care myself for dehydration. I think you guys may have heard that. I've shared that, I think, on a prior live, right? So even as a nephrologist, and a part of the nephrology world, kidney disease world, is hydration. A hydrated kidney is a happier kidney, right? So even with that knowledge, me, I ended up dehydrated because I was focused on other things, and I just forget about myself until I crash. Like for me, sometimes there's no in between. All of a sudden, I'm like, oh my God, I feel, one day I'm feeling fine. Then the next morning I'm feeling terrible. And then I'm like, oh my gosh, I forgot to, drink water for the last couple of days. I'm just drinking coffee, or I'm just drinking this. It's something that can just sneak up on you. So I've learned, literally need to learn, and is a requirement. I've learned that, to not always push to the point of exhaustion. And half the time, I don't even know I'm exhausted until it's way past exhaustion or I've gone too far. So sometimes I pull back and say, you know what? Today is the day I'm just going to do takeout, or I'm not going to do the extra workout today. I'll do it tomorrow. Let me hydrate. It's just incorporating these things into, our routine. That's just what it is. So anyway, so I'd love to hear your thoughts. That's really all I have for you guys. Remember, you matter. Self-care is a necessity. Pampering is a priority. However you would treat your child or your younger brother or your younger sister, a baby, treat yourself that way. And guys, I'm learning that for myself. as a woman, as a wife, as a physician, like these are all hats that I wear, and you guys are also wearing multiple hats as well. So if you have any, tips as to how you take care of yourself, how you pamper yourself, especially those with high acuity kinds of positions, or there's a lot at stake for your performance. Like, if for me, a lot is at stake, of course. I want my patients to be healthy, and it requires like complete laser sharp focus. So a lot of you guys are also like that, and moms especially. You need to be present for your child, and support your child. So you need to have that laser sharp focus, of course, right? So anyway, I definitely want to hear from you. How do you guys self care? What are tips as a caregiver or support person have you used to uplift yourself and uplift, your situation, your family? I need to know. Okay. So I think I'll just close. All right. So absolutely, if you haven't already liked this video, um, if you haven't already liked this video, definitely like it. Hit that thumbs up button. Hit the notification bell so you don't miss out on any of the streams that are coming up. And I think what we'll do is continue on Saturday mornings around this time. Um, yeah, I want to hear from you future topics. So this was really what I had planned for the Ultimate Healthcare series. Like I said, we had done the professional woman, the divorcee, the bride or groom, and now the caregiver and support. So again, I do also offer personalized health plans and advice. So this is not really medical advice. This is information on this platform, but I'm happy to discuss this with you, complimentary for a few people. If you would like, more personalized health information, I'm happy to offer that for you. And I've been doing that the last couple of months, and I think, people really seem to enjoy it. So remember, guys, you are empowered. I want to be a resource for you. So call me, Instagram me or DM me. I want to be a resource for you, and definitely follow this channel, and you can leave a comment, okay? So we will catch you next week. If you have any topic requests, let me know. Thanks, Stout. I do one day at a time, which works for me. All right. You're awesome. Thanks for joining. Thanks, everyone, for joining this live. We'll catch you next time. All right. So follow me at Dr. Ivie OA on Instagram, and we will see you next week. Bye.